Hi, I'm Devon Douglas.
And I'm Carly Putnam. We work for Oklahoma Policy Institute.
I'm an economic policy analyst and I coordinate the Oklahoma Assets Network.
And I cover healthcare and safety net policy.
Today, we're going to talk to you about 9 myths about food security.
Myth number 1.
Food insecurity isn't a problem around here.
Sometimes people think that food insecurity is something that happens in other countries, or at least in famously poor parts of America like Detroit or the Panhandle, out there.
This is inaccurate.
In 2014, an estimated 1 in 6 Oklahomans were food insecure.
Including 1 in 4 children.
Oklahoma ranks 7th for the percentage of children who are food insecure.
Food insecurity isn't the same thing as hunger, although the former definitely indicates a risk for the latter.
If I'm in a family that's food insecure, that means that consistent access to adequate food is limited at times during the year. This is understandably closely linked to poverty.
Myth number 2.
How can people in Oklahoma be hungry when our obesity rate is so high? It's because they just buy junk food, right?
In Oklahoma, 3 out of 4 men and 6 out of 10 women are either overweight or obese.
So are 4 in 10 children.
Perhaps unintuitively, food insecurity and poverty in general and obesity are closely linked.
Low-income neighborhoods are less likely to contain stores selling fresh, healthy food.
Those same neighborhoods aren't likely to have access to transit to get to the neighborhoods that do have healthy food.
When you have a very limited grocery budget, whether you're on SNAP or food stamps or not, you're going to prioritize foods that are low cost, calorie dense, and shelf stable, which typically means they aren't nutritious.
You're also going to prioritize things you know your family will eat, and which take relatively little time to prepare, which can mean Fruit Loops instead of fresh fruit, or canned spaghetti instead of quinoa.
But obesity is about more than food access. It's also about physical activity and how our bodies respond to stress.
Low-income people are less likely to be physically active than their upper-income peers for a number of reasons. Longer work and work-adjacent hours, less access to safe and accessible exercise spaces.
Adverse childhood experiences, such as abuse, neglect, poverty, can all contribute to obesity because of the ways our bodies process stress.
In Oklahoma, about 6 out of 10 people report adverse childhood experiences. Poverty is considered an adverse childhood experience as well, so you can see how this can create a cycle.
Myth number 3.
It shouldn't be the government's role to feed the hungry. That's for churches and charities.
This statement overestimates the capacity of private charity and underestimates the scope of poverty.
For instance, 1 in 7 Oklahomans are on SNAP, or food stamps. That's nearly 600,000 people. That's a lot of meals for churches to pick up.
But we know that SNAP doesn't capture the full universe of food insecurity. There are people who are low income and food insecure who aren't on SNAP. 1 in 5 people eligible for SNAP in Oklahoma don't even participate.
At the same time, the state's food banks increase the amount of food they distribute. They effectively give away record amounts of food every year.
As one pastor I've spoken to put it, we don't expect churches to cure cancer, probably because our churches aren't equipped to do so. So why do we expect them to feed our families?
And similarly, if you ask people who run private charitable giving operations, they'll tell you that the public safety net is part of fighting hunger and fighting poverty. When you're taking on an issue that massive, you use every tool in the box.
It's also worth pointing out that most charitable donations don't even go to low-income Americans. According to Giving USA, contributions to human services like feeding people made up just 13% of donations given in 2012. A much larger portion of charitable contributions subsidize groups catering mostly to middle and upper income Americans, such things like wealthy churches, prestigious universities and private academies, museums, and advanced medical research institutes. Certainly many of these are worthy causes, but they're not in the safety net business.
And finally, government is already the single biggest contributor to nonprofits nationwide. According to the Urban Institute, private contributions made up just 13% of nonprofit revenue in 2010. Government grants and other government payments, by comparison, made up 32%.
Maybe a different way to look at it is, wouldn't it be great if the need were so low that private charity could actually handle it? Like, how do we get to that point?
Myth number 4.
People on food stamps just need to get jobs.
4 in 10 Oklahomans who receive SNAP are in working families.
3 in 4 Oklahomans who receive SNAP are in families with children.
1 in 3 Oklahomans who receive SNAP are in families with members who are elderly or who have disabilities.
So a lot of people on food stamps are people that we either can't or don't expect to hold jobs.
And then there are the people who take care of the people who we don't expect to work or hold jobs.
Of those who can work and don't have those dependents, we call them able-bodied adults without dependents, or ABODs. They can only get SNAP for 3 months every 3 years in Oklahoma. This rule was temporarily relaxed during the recession, but it is back in effect now.
Myth number 5.
The food stamp program is full of fraud and abuse.
It is not.
States determine eligibility and benefits based on household characteristics and income and deductible expenses. The state verifies that information by data matching, paper documentation, interviewing employers and landlords. Households have to reapply every 6 months, and they have to report any changes that could affect eligibility. And there are audits.
SNAP has a rigorous payment error measurement system. States thoroughly review a representative sample of SNAP cases. Then the feds re-review a sample of those cases, and states are hit with penalties if their error rates are higher than the national average.
In 2014, the payment error rate was less than 4%. And if you subtract out the underpayments, where people received fewer benefits than they should have, the net loss to the federal government was slightly more than 2% of the benefits paid out.
By comparison, the IRS puts the average tax non-compliance rate for 2008 to 2010, the most recent years for which data is available, at 18.3%, which is $450 billion loss to the government.
So basically, before you start peeking in other people's grocery carts, maybe take a look at your tax returns.
Maybe. Myth number 6.
We just can't afford to keep spending taxpayer money on welfare.
We can't afford not to.
Through the funds that it supplies, which can only be used on a certain set of grocery items, SNAP kept about 140,000 people in Oklahoma out of poverty every year between 2009 and 2012. Half of them were children.
Without SNAP and similar programs, 15% of Oklahoma children would be below what we call the deep poverty line, which is 50% of the federal poverty level, or about $8,000 per year for a single mother and her child. Instead, because of programs like SNAP, our deep poverty rate for children is around 2%.
SNAP also has a much broader economic impact. SNAP dollars get spent. They don't get hidden in tax shelters in the Caymans or socked under the mattress, and they get spent at local retailers. This is money that would not be entering the economy without SNAP, because without SNAP that money simply wouldn't be there to spend. An estimate suggests that every dollar on SNAP generates $1.70 in additional economic activity. In 2015 alone, SNAP benefits put $865 million into Oklahoma's economy.
Myth number 7.
How can people be too poor to have food but have things like TVs and cell phones?
Sometimes wannabe pundits like to say that people who use safety net programs and have certain status indicators, iPhones, a car, a nice pair of shoes, clearly can't actually be poor, and that's often used to try to delegitimize programs for people in poverty. This is a problem from a couple different angles.
It assumes poverty is a totally static state, that people can't have purchased that car or that jacket when times were better. What are you supposed to do? Like sell your SUV when you lose your job? Trade in a $700 a month mortgage on a house that will eventually gain equity for a $700 monthly rental that you're obviously not going to be able to sell?
It also assumes that poor people don't have friends or family or community, that those shoes couldn't have been a gift, that people in poverty only know other people in equal and greater poverty who are not at all kind or generous to each other. Anyone who's ever paid into a GoFundMe for a medical bill knows that that's not true.
It assumes that basic needs, the very basic ones, don't apply to people in poverty. This mostly speaks to the phone question, but internet access is necessary in many places to maintain a bank account, to apply for jobs, to pay rent. It's how you communicate with your job, your kid's school, your health center. By and large, smartphones are a necessity, and even more so if you don't have a desktop or laptop computer in your home, or ready access to a public library, or steady access to a landline. Plus, phones can be used to store documents needed for jobs or benefits, like birth certificates. Phones are ridiculously more important than we often think. They can also be gotten relatively inexpensively, especially if you have a friend or a loved one who's getting a recent upgrade. So, C point the first, you could have already just had the phone as well. Phones are not frivolous and they do not equal wealth.
It also assumes that poor people just shouldn't be able to have nice things. Even if I do sock away $10 a month for a year to get myself a nice pair of shoes, so what? Even if I do buy myself a pecan pie from research because I had a terrible week and I want to eat my feelings, even though that's going to be money I can't spend on better groceries next week, so what? Neither of those expenses, even taken together, would have ever gotten me out of poverty. They wouldn't even pay the electric bill. And when we expect people in poverty to always, always, always make the right decision, we're frequently holding them to a much higher standard than the ones we hold ourselves to.
Myth number 8.
Government food programs encourage dependence.
This tends to overestimate how generous our safety net programs are and underestimates the level of effort it takes to participate in them.
The average monthly SNAP benefit per member in Oklahoma is $120 per month. That's $1.34 per meal. That's not an easy grocery budget. I'm not saying it can't be done, but it can't be done easily, particularly in neighborhoods where low competition in the grocery market drives prices up.
SNAP is a really responsive program. When the economy is doing well, enrollment drops. When the economy is doing badly, enrollment grows. SNAP enrollment jumped 50% in Oklahoma during the recession, and it hasn't dropped since then. The problem here isn't with SNAP, it's that too many families can't get ahead.
Some of the workers in Oklahoma who qualify for SNAP include corrections officers and teachers. You know, freeloaders.
And with that, myth number 9.
This is all very sad, but it's not my problem.
But this is your problem.
This affects all of us. And if it doesn't directly impact you and your family, I guarantee it hits someone you know, or even people you don't know, but who are still your neighbors, people your kids go to school with, or the girl who works at your favorite coffee shop, or the guy who lives across the street.
So yeah, support your food banks and give at your local faith-based institution.
But also,
Tell your local legislators that you want local safety net programs strengthened.
tell your legislators in Congress that you want federal safety net programs strengthened.
Support a minimum wage increase.
Expand refundable tax credits like the Earned Income Tax Credit and the Sales Tax Relief Credit.
So protect and expand Medicaid.
Increase cash assistance.
There's no single cause for poverty, and that means there is no single silver bullet.
We do these insecurity things around Thanksgiving for maximum impact, but food insecurity doesn't get a holiday. Charitable giving spikes during the holiday season, but the need lasts all year.
For instance, food insecurity increases in the summer when kids lose access to breakfast and lunch at school and family income doesn't magically expand to cover those meals. Give to your food banks now, but remember them in July, too. And remember that cash is often the least heartwarming but most effective way that you can help. Automatic monthly giving is one of the best ways you can do that. We'll put donation links in the doobly-doo.
We can also donate to Oklahoma Policy and sign up to be a part of the policy solution with Together Oklahoma.
Thank you.
Thank you.